Welcome to Athletes on Balance, where we talk to athletes, coaches, and experts about mental health in sports. This is a stigma-free zone for inner thoughts and outer conversations. We're helping athletes and anyone with mental health challenges perform at their best, on and off the field.
Hi, everyone. Welcome to another episode of Athletes on Balance. I'm your host, Walt Norley, founder and CEO of OnBalance Health. Today, I'm fortunate to be joined by Dr. Katie O'Neill, Chief Medical Advisor for the Southeastern Conference, a position she's had since 2022. Within her role, she advises SEC Commissioner Greg Sankey and other SEC staff regarding the health and safety of the conference's student athletes. Dr. O'Neill works on initiatives, standards, and educational resources that help care for and foster the mental and physical health of SEC student athletes. Additionally, she is a member of the SEC's Medical Guidance Task Force. Part of what led her to this current post with the SEC stemmed from her leadership role that she displayed a few years ago. Dr. O'Neill was credited for helping the SEC athletic program safely navigate the pandemic, which ultimately led to the 2020 football season being played. Well done. I remember reading about that, Katie. Dr. O'Neill is an associate professor of clinical medicine at the LSU Health Sciences Center, has also served as chief medical officer at Our Lady of the Lake Regional Medical Center in Baton Rouge since 2020. Before being appointed to her current position at the medical center, she spent 10 years there as medical director of infection prevention. She was also a member of the NFL's COVID-19 Medical Guidance Committee. Dr. O'Neill, what an exceptional background and resume. As I've said several times now on this podcast, mental health is personal to me. I've managed a bipolar disorder for more than 4 decades within my business life. Although a different area, I appreciate the time and performance pressures as a former student athlete when I played quarterback at both Ohio State and Georgia. My personal mission is to improve the quality care for athletes and help destigmatize mental health. It's certainly long overdue. Dr. O'Neill, I appreciate you joining me today.
Thank you so much for having me, Walt. I think this is such an important topic, and the more we talk about it, the more we'll find some helpful solutions.
Well, I agree, and you're an important part of that equation. So let's talk about the overall college athletic world. Over the last few years, and certainly with the pandemic, the suicide rate among student athletes has increased. The data seems to be telling us that there's more student athletes perhaps suffering in silence. Why is there a mental health crisis going on in college athletics?
I think twofold. There's a mental health crisis occurring in America, and especially in the age group in which college athletes find themselves in. And so they are part of a just huge mental health crisis in our young people. Now, in college athletics, I think that is magnified for a couple of different reasons. If you look at why we are having a mental health crisis, we have had a sort of decentralization of community. Some of that is about social media and the time we spend on screens and how we are interacting with our communities. That is not what you and I would say is community interaction. And then the pandemic sort of lit a fire under that issue, which is people went inside their houses and stopped interacting with their communities and are not back to interacting the same way that we would all enjoy. And study after study shows that having a supportive community in front of you helps with your mental health. So that's a big piece of why we see mental health issues happening. I mentioned social media. That's also a big piece of it. Learning how to cope with the pressure in a growing mind for a lot of immediate feedback. We know it's not healthy. We don't necessarily know how to take it away from kids or how to help them manage it if we're not going to take it away. And so I think we're still in a huge learning phase of what do you do with a screen and a growing mind. And unfortunately, we're learning while the issue is happening. Right. And then lastly, we have a country that still has issues. We have a lack of access to healthcare, a lack of access to education. We have a lot of poverty issues. And again, when you look at student athletes, many of those things are supersized in our student athletes. They come from many student athletes come from impoverished backgrounds. This is their only sense of self. And they bring with them a lot of issues that we have to tackle along with their desire to have a great college athlete experience.
Are there programs for that?
No, I think that we're designing them as we go. And the current level of student athletes, our current, say you take our 4-year freshman to senior, even though we've got a lot of 5th year athletes. If you take your 4 years, every one of those athletes came into college, probably injured before. So, again, supersizing student athletes and their mental health issues, they are often injured before they get to college. But they are also already on Instagram, Snapchat, Twitter, and to get to them at that age and say, hey, I need to recreate how you think about these platforms is very difficult, because it should have started in the 6th, 7th, and 8th grade, the first time they got a device. So I think that there are some management plans now, but they're very much in their infancy, even though we know it's a problem.
So that's an element when you define a crisis going on within collegiate athletics.
Right.
You're a trusted voice. You're an expert. People listen to you. Knowing that's part of the element, knowing that you're trying to essentially teach different methods of how they behave. It's behavioral, I assume. What are some of the other solutions that you see that are needed to address the crisis?
I think that we're going to have to figure out who our workforce is. And I'll use a different example, because I come from a super heavy medical background, not mental health background, but when you solve a medical problem, it's all the same. Lots and lots of people were dying from heart attacks 15, 20 years ago. And we spent a ton of time making cardiologists. And we didn't spend a ton of time making dietitians, primary care doctors who focused on obesity, primary care doctors who focused on activity. And that came later, 15 to 20 years later. So right now what we see is we have a mental health crisis, and we're very focused on the acute stage. You have an issue and I need to put somebody in front of you. And for many of our colleges, they're still there. I just need to find enough people to handle the immediate acute issue. What we would like to try to grow, but we need to understand who those people are, I need to meet you 10 years before that. And let's talk about healthy living. Let's talk about healthy interactions with social media. Let's talk about the things you're bringing into athletics with you, your peer pressures, your family pressures, your community pressures. Are those mental health providers, or are those our coaches, our athletic trainers, the same community who surrounds an athlete all the time? Is it maybe educating them on some of those tactics, so that we don't have to build a mental health team that's so big that we have a mental health provider in every high school, because that will take 30 years.
That's a dynamite analogy that you made with a cardiologist, because and then segue then into what's going on with the mental health, because you're talking about really reactive, proactive in a lot of ways, right?
That's right.
With the heart, you got a lot of cardiologists. They're treating the immediate acute situation, but to your point, they're not doing all the behavioral things that could be preventative. And the same thing when you go into the mental health situation that's modern day. And I'm sure you agree with this, that the educational piece of that and the acceptance to be educated has to be part of that, right? Especially when we talk about the athletes, right? I mean, it is. The reality is it's a different mindset, and part of the mindset is, quote unquote, mental toughness, right? Mental strength. And, to talk about, a societal perceived weakness is not an easy thing, right? Which I guess leads to resources like yourself and other people that are at the university level. So as SEC's chief medical advisor, you're responsible for several areas when it comes to fostering the overall well-being of the student athlete. What mental health initiatives are currently in place within the conference?
So I came into the conference with a couple of mental health initiatives already set by our mental health teams. They're very healthy for each other. So our mental health teams around the conference they were meeting on about a quarterly basis by Zoom, and then they met every summer in person. So they got to know each other and really fed each other's need for learning and best practices. So that was said. Well, they also had a May mental health month and an October focus on mental health, that they made sure that each school sort of had some programmatic support around decreasing stigma, making sure that we're focusing on wellness, and trying to get at two different things. I need to show you that you have access, and then I need to keep you well so that I don't need that acute access. That was in place. When I came in and started meeting with these teams, the things that we've been focusing on is when we say access, our athletes mean I want somebody in front of me, but sometimes I'd also like to seek out care away from campus. So how do we strike that balance and offer the access that the athlete wants? Lots of athletes want somebody to sit next to them at lunch because that's their only time to talk to somebody and talk then. And there are some athletes who want care away from campus. So how do we offer it with all our campuses? We've looked at some online offerings. We're still talking about, is there some commonality that we can share, where if I'm in Nashville, but Tennessee's got a great behavioral therapist, maybe we start to share those resources, and we spent the last year doing that. And then what I'm really excited about is we just rolled out our mental health survey for our campuses, because like heart attacks, I don't know what I don't know. So we don't know the burden of our mental health issues on campus, and we don't know our current resources across the SEC. And the only way to know that is to start looking for them and saying, let's catalog what we have, what we would like to see. And that way, year on year, we can show improvement in our programs. And so we have to measure our success, right? And this year we'll roll out our first measurement of success.
Well, and that's really impressive, and I'm actually drawn a little bit to what you said about the online shared resources. Yeah, do you have data, to your point? And I assume that people, the student athletes that won off campus counseling or treatment, is that for privacy purpose, or is it before? I mean, in other words, is that tied to judgment and privacy?
Right. Yeah. It depends. It depends. We've really taken a lot of our cues from our student athletes, and they've been so open about what they want. It's been really helpful. Some of our student athletes, you have a small mental health department on campus, and so maybe they know that some of their other friends go there and they have a particular problem, and they still don't understand confidentiality. So it just makes them nervous. If my buddy's going to that person, I'd like to go to somebody else. So we've educated them a lot on confidentiality, but I still think there's a worry. And then some of our student athletes are just looking for somebody who looks like them. Right. And because mental health providers are in such short demand, you're really lucky to find a passionate mental health provider who understands athletics at all to be embedded in your athletic community, to get to the nuances of what we all want as a patient, to be able to truly connect to somebody. It'll be hard to provide that for all 500 of your athletes every year. So some of them are just looking for an option.
Well, I have to tell you, I think that, if you can pull together the remote, if for lack of a better term, remote resources that have the quality, the passion, and have the athletic knowledge and experience with dealing with it, that would be very powerful, because I do know there's a shortage, and it's a shortage.
Yep. And understanding the athlete life. I mean, you can imagine, as a former athlete, you may get on a mental health call with somebody who doesn't understand your schedule, and they're going to say, I don't think you need to do this anymore. Well, that's not what you need to hear. You need to hear somebody who understands your training schedule and class schedule and how you're balancing that and helps you work through it.
Right. Well, I applaud you for trying to pull that together. So you're on the front lines. You've witnessed a lot of change that's happened, especially since the pandemic. Are there specific areas the SEC is looking into to improve mental health resources?
So I think you mentioned data, and I think that's the first place that we're looking. We can only improve mental health resources when we have the data to show that those resources are obtainable and that they're helpful. Because what we don't want to do is give our student athletes the illusion that we have given them a lot of things and they weren't the things they needed. Right. And so I think that is our first charge, is to make sure that as we add layers of mental health support, that those were the layers that made a difference to the student athlete. And that comes back to having data. So we're really embarking on this first survey of our programs this month. Will give us a great way to look forward into what our plan's going to be.
Well, part of that data I was thinking about on the last topic is, what percentage of the student athletes would like to seek outside campus care?
That's right. So that is one of the questions on our on our survey is how do you like to receive care, and what care would you like to see added? Is
Right.
it online? Is it group therapy?
Right.
Some athletes love group therapy. Going back to community, it's really fun to have a group therapy session about how to play the game well, right? This is something we can all get around, but it gives you a sense of community. So we'll see what their answers are, and we'll make a plan.
That's interesting. Not to belabor it, but the fact that well, because it's worked in non-athletic treatment, substance abuse, et cetera, where the group element, with kind of, and especially when you go to the specific of a student athlete, like people with them are dealing with issues, and hearing it from somebody who's quote unquote a peer, right? So interesting.
That's right.
I'd like to focus on something that I also think is highly important to universities and student athletes. What mental health care guidance does the SEC have in place for the student athlete? And also, how can you ensure that those guidelines and best practices are actually being followed?
Right. So as all colleges, we follow the NCAA's guidance. The SEC specifically does not add any additional layers of guidance. We want to make sure that our schools can complete the guidance given to them by the NCAA first. The NCAA's list of best practice recommendations is long and hard to achieve for a holistic program, and especially with staffing. We just, to say that we need somebody there and then to go and find that person and keep them there are two totally different issues.
Right.
And so what we've done is we've said, let's look at the NCAA's recommendations and let's see if our schools can meet them. And then can we improve upon them and develop a standard that we all agree is even better than these recommendations where possible. But what the SEC is not after is making a set of rules that we hold schools to, because this is a dynamic situation, right? It would be lovely if we were able at some point to say, and you saw this with Ole Miss just a few weeks ago, everybody on this campus is involved in mental health. It's not about having 2, 3, or 4 providers. We don't want to get into rules like that. What we want to do is say, do you have an emergency action plan that catches everybody? Are you making sure that that works? And is everybody trained? Everybody's trained in CPR. Is everybody trained to handle a mental health issue? And so those are the kind of best practices that we're really focusing on versus having a set of rules that are a little bit harder to make sure that we can follow on each campus.
So to the point you mentioned earlier about attaining more data, and then I assume there's you have the university feed of data, and then I assume that the conferences, the SEC, have a feed for the NCAA. I mean, in other words, the NCAA has to be making decisions based on information that's coming from somewhere, right?
Right. NCAA conducted 2 mental health surveys just a couple of years ago that every NCAA school participated in. Their mental health surveys were much more about your mental health, not about resources that each school had, but when an athlete or a coach filled out that survey, they were talking about, how do I feel about my mental health? Do I feel like I'm supported? Do I struggle with certain things? And those survey results were actually fascinating for us. It made us say, when we do the survey on campus, we want to make sure we pull in staff and coaches and get their aspects of mental health too. But where we're going to take that survey from and learn from is, now we need a survey about resources and data. What do people really want? So our survey is a little bit less about how do you feel about your mental health, Walt, because the NCAA has already surveyed our athletes for those purposes.
So it sounds like it's because the situation's fluid, that the process of what you're putting into place that's realistic has to be fluid as well. And
Yes.
you're looking for data insights for these decisions to be made in terms of what is realistic, right?
That's right. That's right. I don't want to pigeonhole anybody into a list that says this is the best way, because
Right,
we don't know the best way.
right,
And we also don't know between, speaking from an SEC lens, but then we could talk about all student athletes. In the SEC, we have schools who have very different resources. I have schools that are right next to an academic medical center with a whole department of psychology and psychiatry. And we have schools that have a 200-bed hospital in their town, and their town's lucky to have a mental health provider, right?
right.
So we cannot apply just a layered approach to every school. Instead, we have to say, you need to figure out how to best fit your population of students.
Well, it's the very good news is that you've got a program that you're working on, and you understand that, as you said, there's resource differentials and there's environmental differentials with something more metropolitan, something a little bit more rural. So let's talk a little bit about the future. I know you don't have a crystal ball, but I'm going to ask anyway.
That's okay. I put my crystal ball up after COVID.
Yeah, right. So to a lot of people. So how do we, hopefully at some point we get to the point where, the stigma is reduced, and it's treated. This has been a kind of a mantra of mine, Katie, that it's very much like the physical world that you've been in. So you're talking about a depression situation, an anxiety situation, similar to you're talking about your knee, your shoulder, or your ankle, right? And in other words, you're open about it. So kind of the crystal ball, in 5 years, what will the SEC mental health program potentially look like?
In 5 years, what I hope to see from the SEC is that I can show you incremental success in how our student athletes feel about how they're supported, and that they can tell you what their resources are. That when we walk up to a student athlete, they say, I absolutely feel like if I had an issue, I could go to anybody. I feel well, and let me tell you about my wellness. And this is how I access resources on campus. If we can get that accomplished, because when we looked at the NCAA survey, more than 30% of those athletes said that they didn't even know that they had mental health resources on their campus. We have a huge hole in awareness. And then if you're aware, then we can address stigma, right? So I hope in 5 years that we have complete awareness, that they feel comfortable, which means we're addressing stigma. And in that time, because I have a lot of wish lists, Walt, I would like to see that the SEC is fostering future careers for our student athletes in the mental health space. And we talk about the student athletes a lot. If they want this, then we also need to find student athletes who are willing to go into this space as a career. And how do we begin to foster that conversation?
Well, just from again, awareness, seems to me, I mean, again, I'm on the outside of the fence, so it's easy for me to say something like this, but what you first mentioned is that they're not even aware that there's a program that exists. I mean, the athletic department, I assume, would be responsible for coming forward with creating that awareness.
Yep. It's on a poster. Yep. It's on their first meetings, but I got to tell you, I've been at this hospital for 12 years. And every time I look at the orientation packet that we hand out to each physician, I say, did I get that? Because when you first come in, it's too much, right?
Right.
So you have to be repetitively reminded of the resources that are available to you. You can't just check a box.
Right. It's touch points, more touch points, throughout the school year. Yeah.
That's
So within that, with that happening in a 5-year period of time, how does that help the student athlete? How does that improve the actual care? What's the result do you think comes out of that?
Right. What I would hope to see is more visits for wellness and less visits for acute issues. And that also goes back to data. How do we track that our programs become preventative and less about treating acute issues and really spending a lot of time with an athlete in crisis? And only through better data on the disease itself within our programs are we going to be able to understand what our providers are spending the majority of their time on.
Right. Well, at the end of the day, as you know, the drive is for a better outcome, right? Mm-hmm. And I love the thought process of, essentially proactivity as opposed to, constantly in reaction mode. So I'm impressed on a lot of things, Dr. O'Neill, but I'm also very impressed by all the positions that I mentioned up front in the introductory. And, with all that being managed, you're married with 3 children, you live on a farm that I mentioned earlier that I've seen pictures of, and you maintain that with your husband, in other words, not farmed out. How do you juggle all of this and keep your own mental health in check?
Yeah, I think, sometimes it feels just absolutely crazy. And I don't know. And we have to kind of reset what our expectations for our family are and what our expectations for our careers are, which I think that's the natural progression of life. But our busyness, or the things that we choose to be busy. And I learned how to drive my husband's tractor this weekend. It's much bigger than mine. I have a tiny little tractor, but I couldn't get done what I needed to get done, and he didn't have time. I did not want to learn how to drive that thing, and I was nervous. I didn't listen to music. I paid attention the whole time. But I did it, and I stretched because it makes me happy to finish my work. I have that farm because it makes me happy. And that's part of my wellness journey. So I think that what I've learned through this process, and what I hope that we can continue to show for our athletes too, is, make good decisions about your wellness, make good decisions about, even when you're busy. College athletics is fun. It should be fun. It should be filling your cup up just as much as it's difficult. And I think that what you'll see with my husband and I is our busy life makes us happy. And that's why we do it.
And your children are watching this and learning and seeing that we hope that you're the same mentality, right?
Yeah. No, they have to help us, and we put to work too a little bit, but I hope that from that they start to pick up things that make them happy and don't, and make choices about how to fill their cups up as well. And that's our job, right, Walt? If we need to be productive. We need to be a part of our community. And at the end of the day, we need to say that most of our choices were to help to make sure that everybody around us was happy.
That's a beautiful thing. So one last question that I ask every guest that I've had, and it's always an interesting question and answer. I know you've probably inspired a lot of people within your career and within your life. Who's been most inspirational within your life journey?
No one person. I am inspired by my patients. I think that I'm often asked why I don't give up patient care. It is the administrative part of my job is big, but there is just nothing better than watching somebody get better. And it's patients teach you so much about how to overcome hardship, from the small things to the big things. And if they can do that, then we can do anything. So I think that's why I love medicine. It's a continual reminder of people who inspire you.
Our world and our society is a better place because of yourself and people like you. So what a great answer. And I'm sure that's inspirational for everybody watching and listening. So it's been wonderful to have you on our relatively new Athletes on Balance. I think we do have some things in common with what we're trying to accomplish with, this platform and this venue, and having people that are true experts that are making things happen, as opposed to just, chatting about it. You're actually doing it. So I commend you for all of it. And I thank you for it. As a former student athlete, I have children that were, collegiate student athletes. So I understand what's going on within that dynamic from a personal standpoint. And I thank you for your time. I know you have given all this, I know you have a very busy schedule, and I know it's packed. So
happy to make the time.
I thank you for that. So finally, I'd like to thank all of our listeners for joining us. We're driving here to create a greater awareness of the athlete's plight with mental health challenges, which we hope leads to the destigmatization that is associated. Be well, everyone. I'm Walt Norley, and this is Athletes on Balance.
Thank you for joining us for this episode of Athletes on Balance. If you enjoyed what you heard today, please follow us on your preferred podcast app to catch our next episode. Join our community by sharing with an athlete, mental health care provider, or coach in your circle.